What is going on, everybody? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my pathology playlist. In previous videos, we talked about cell adaptation, cell injury, cell death, atrophy, hypertrophy, hyperplasia, metaplasia, dysplasia, neoplasia, apoptosis versus necrosis, benign tumors versus malignant tumors, hypoxia versus hypoxemia, and much more. Today, it's time to talk about the pathological calcification, including dystrophic calcification and metastatic calcification, where there is too much deposition of calcium salts into various tissues. Now click the like button, click the subscribe button because I'm feeling chalky. This is my pathology playlist. Please watch these videos in order for maximum understanding and retention, not to be confused with my patient's urine retention. In order to get the most out of this video, please watch my video on calcium homeostasis first. You can find it in my physiology playlist. Now get a piece of paper and doodle with medicosis. What are we going to talk about today? We're going to talk about calcium. There are 3 hormones in the human body that can affect calcium homeostasis, and these include the parathyroid hormone, also known as parathormone, and calcitonin, and vitamin D, particularly the 1 and 25 dihydroxyvitamin D. What does PTH do to the serum calcium? PTH is going to raise the calcium in the blood. However, PTH is a phosphate trashing hormone, so it will trash the phosphate and lower the serum phosphate. Calcitonin, just like somatostatin, hates itself, so it lowers both the calcium and the phosphorus in the blood. Vitamin D is the best because it's going to increase both. It's going to increase the serum calcium and it's going to increase the serum phosphate. Why do I like vitamin D so much? Because without vitamin D, please note what happens to phosphate. PTH trashed the phosphate. Calcitonin also trashed the phosphate. So without vitamin D, you will suffer from hypophosphatemia, and this is very dangerous because without phosphate, you cannot make adenosine triphosphate, which is the energy currency in the human body. Next, how did PTH raise the serum calcium? The answer is by 3 different mechanisms: resorption, absorption, reabsorption. What do you mean by resorption? I mean I'm going to break down the bone and bring the calcium out of the bone and into the blood, just like that, from the bone and into the bloodstream. This raises the serum calcium. Next, we have absorption. What does that mean? Absorption means in the gut. So here's the gut, and I'm going to absorb the calcium to the blood, which will raise the serum calcium. Third, we have reabsorption. Reabsorption takes place in the kidneys. The kidneys are going to reabsorb the calcium back into the bloodstream, which will raise the serum calcium. All of this is physiology. But how about pathology? This was homeostasis, but what about the lack of homeostasis? If you wish to see more videos like this in the future, please drop some bone emoji in the comments. What is pathological calcification? It's the deposition of calcium in different tissues. Can we be more specific? Sure, it's the deposition of calcium salts in the tissues. But is it just calcium? Absolutely not. We also have smaller amounts of iron, magnesium, etc. How does this calcium deposition look like? White, chalky substance. In the previous video in this pathology playlist, we have talked about necrosis. We have many different types of necrosis, including coagulative necrosis, liquefactive necrosis, caseous necrosis, fibrinoid necrosis, fat necrosis, and gangrenous necrosis. Almost any type of necrosis can cause pathological calcification. There is something that your parents should have taught you but didn't. This is the sequelae of necrosis. What happens after necrosis? Many things happen after necrosis. Let me tell you about the important 3. Number 1, phagocytosis of necrotic debris. After necrosis, after the cell goes to hell, there is a bunch of debris. The macrophage or other phagocytic cells are going to come and eat that debris. This is true if we started with a small area of necrosis or small number of cells that are finished. But what if, and that's a big if, we have a larger area of necrosis because many cells are gone by necrosis? In this case, we will certainly have an inflammatory response. And if that was not enough, you will have organization as well. Look, when a pathologist says the word organization, We do not mean getting neat and tidy. Organization in pathology has a specific meaning. It means fibrosis. And this is the second sequela of necrosis. But what if the necrotic tissue cannot be completely removed or cleared? What's going to happen? Well, if you cannot remove it and you cannot fibrose it, then at the very least, you can calcify it. And this is called dystrophic calcification. So, if we have a small number of cells dead, we have phagocytosis. If we have a larger number of cells that died by necrosis, we will have inflammation and fibrosis. But if we cannot perform phagocytosis or inflammation and fibrosis, if we cannot clear the necrotic debris, guess what's going to happen? Dystrophic calcification. So what happens after necrosis or degeneration? Let me remind you of myocardial infarction. Here is the heart. The cardiac muscles are dying. Myocardial infarction. This is death. This is not injury anymore, it's death. And when the cell is dead, the membrane of the cell is gonna lose all of its integrity, just like your typical politician. And therefore, any enzyme that was inside the cell is going to be released to the outside. LDH is going to be kicked out. How about Mr. Myoglobin? Kick it out, so it's going to increase in the blood. How about CKMB? Increases in the blood. How about something like troponin? Also increases in the blood because they are being kicked out of the cell because the cell has lost its membrane, which means all of the enzymes are going to leak outside. Here is a question for the pros. What subtypes of troponin are released after a myocardial infarction? Is it just any troponin, or do we have specific subtypes of troponin being released after an MI? Let me know your answer in the comments. So what? I released a bunch of enzymes to the bloodstream or to the extracellular fluid. So what? Well, these enzymes can definitely alter the pH. I can think of that. And they can break down organic phosphate. I can imagine that. And remember that there should be a delicate balance between phosphate and calcium. If you disrupt one, you can disrupt the other, and this can lead to calcium deposition, especially if the medium becomes more alkaline or basic, which means with high pH and low hydrogen ion concentration. Why is this? Because alkalosis favors calcium deposition. Look, there are two forms of calcium. There is calcium that is not ionized and not charged and bound to something. And there is another type of calcium which is ionized and charged and unbound to anything. What alkalosis does is that it takes some of that doozy ionized charged active calcium and deposits it into the tissue in this form that is bound to the tissue, not freely floating. So alkalosis favors calcium deposition, which means with alkalosis, you will have more calcium deposition, but you will have less ionized calcium in your blood. And whenever you have less ionized calcium in the blood, guess what's going to happen? Calcium is contra-excitability. Calcium is contra-excitability. Excitability of what? Of nerves. And what's going to happen if my nerve excitability increases? I will suffer from a condition known as... And I've talked about tetany in great detail in my endocrinology playlist. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. If you want me to personally tutor you, reach out to me on my website. Let's talk about pathological calcification. All right, we have two subtypes of pathological calcification: dystrophic calcification and metastatic calcification. What is dystrophic calcification? Dystrophic calcification is a local calcification caused by a local injury or a local problem. However, metastatic means global or systemic or diffuse or generalized or all over the body, caused by a global problem, a global issue. That's the difference between dystrophic and metastatic. I mean, if something is systemic and all over the body, we're gonna call it metastatic. In this case, metastatic does not necessarily mean cancer. It just means spread out all over the body, because meta means change and static means location or site. Oh, I am being transferred into a different site, meaning all over the body. Some etymology action. Dystrophic, what does that even mean? Trophy means growth. not as in a trophy wife who's gonna take all of your money. Metastatic means metastasis, change the site or the location, meaning widespread. Dystrophic calcification, we have a local cause leading to local calcification, but in metastatic calcification, we have a global or generalized or widespread or systemic cause leading to a systemic calcification. Calcification in many different disparate organs. If dystrophic calcification is local, then we expect that the serum calcium concentration is normal because this is not a systemic issue. But in metastatic calcification, it is a systemic issue. It's all over the body, so we expect that the serum calcium will be high, and this is the cause of the global calcification. So you get calcified, and you get calcified, and you get calcified. In dystrophic calcification, we have a local cause. Give me examples. Could be necrosis or could be degeneration. The tissue is dead or the tissue is diseased or sick. This is dystrophic calcification. It's the D mnemonic. And therefore, the calcium will be deposited in a diseased tissue, not in a healthy tissue. The calcification is local in dystrophic calcification, such as a calcified aortic valve, which can lead to aortic stenosis. To learn more about valvular heart diseases, see my cardiology playlist. But in metastatic calcification, we have a systemic issue, such as what? Such as hyperparathyroidism or hypervitaminosis D. When PTH is high, what's going to happen to serum calcium? Of course, it will go up. When vitamin D is high, what's going to happen to serum calcium? Of course, it's going to go up. The PTH will raise the serum calcium by means of resorption, absorption, and reabsorption. Vitamin D is going to raise the serum calcium mainly by absorption in the gut. The tissue was normal, but then we just kept throwing all kinds of calcium at these different tissues because we simply had too much calcium in the blood. And this excessive calcium simply had to go somewhere. To learn more about hyperparathyroidism and hypervitaminosis D, please refer to my endocrinology playlist. So in cases of necrosis, what kind of calcification do I get? The answer is dystrophic calcification. How do I get it? This is the mechanism as we have discussed before. So what kind of calcification happens because of necrosis? It is the dystrophic calcification, because dystrophic calcification happens when the tissue is dead or when the tissue is diseased. Necrosis leads to dystrophic calcification, a local issue causing a local calcification. What else? Thrombosis, which can definitely cause necrosis. Atherosclerosis, which can lead to necrosis from ischemia. CREST syndrome, what does the C stand for? Calcinosis cutis and high anti-centromere antibodies. The R, Raynaud's phenomenon. The E, esophageal dysmotility. The S, sclerodactyly. And the T is telangiectasia. I've talked about CREST syndrome in detail in my rheumatology playlist. Next, the torch infections, which can be transmitted from the mother to the baby during pregnancy or during labor. What does the acronym TORCH stand for? Let me know in the comments. Next is psammoma bodies, which will be the topic of the next video. But how about metastatic calcification? It could be hyperparathyroidism or hypervitaminosis D, which are going to raise the serum calcium. This calcium is going to deposit at normal tissues. So you get calcification, and you get calcification, and you get calcification. Why these specific organs? Because remember, I've told you before that alkalosis favors calcium deposition. Can we have some alkalosis in the kidney? Absolutely, because as the kidney is trying to push and excrete the hydrogen ions into the urine, it's making the peritubular capillaries, the blood, more basic. Next, as the gut is trying to generate acid for the lumen or the cavity, it is generating bicarb, the base, onto the outside. Next, the lungs. As the lungs get rid of carbon dioxide, which is an acid, they are retaining the base. And alkalosis will favor calcium deposition. What causes hyperparathyroidism? Well, it could be primary hyperparathyroidism or secondary hyperparathyroidism. Primary hyperparathyroidism could be caused by a parathyroid hyperplasia or adenoma or adenocarcinoma. Whatever the case might be, at the end of the day, the parathyroid glands are making too much PTH, which is going to raise the calcium. Causes of secondary hyperparathyroidism include malnutrition, cholestasis, hypovitaminosis D, hyperphosphatemia, and chronic kidney disease. Fun fact about chronic kidney disease, in the beginning, the kidney loses calcium in the urine, so serum calcium decreases. But in response to this, parathyroid will keep making more PTH and more PTH and more PTH. As this happens, the excessive PTH will raise the calcium and raise the calcium and raise the calcium and raise the calcium, and at the end of the day, you end up with metastatic calcification. Dystrophic calcification versus metastatic calcification. A local cause leading to local calcification versus a global systemic cause leading to a systemic calcification. In dystrophic calcification, we have necrosis, so this is bad tissue, diseased or dead tissue. But in metastatic calcification, the tissues were normal before you calcified them. In dystrophic calcification, the systemic serum calcium is normal, but in metastatic calcification, the systemic or serum calcium is high. Psammoma bodies. Let me ask you a question. Is this an example of dystrophic calcification or metastatic calcification? The answer is dystrophic calcification. The tissue is either diseased or dead. What are the psammoma bodies? Concentrically laminated or lamellated calcified spherules. Circle upon circle upon a circle upon a circle. Do not stare at this shape too much because it's not good for your vestibule. I'm talking about the vestibule in your inner ear. So what is the cause of the psammoma body formation? Here is something that your professor will never tell you. Listen carefully. Any papillary structure in pathology can cause psammoma body formation. Example, papillary thyroid carcinoma. Oh, it's a cancer in the thyroid and it's papillary. Can I get psammoma bodies here? Absolutely. How about adenocarcinoma in the lungs with a papillary structure? Oh, it's papillary. Can I get psammoma bodies here? Yes, indeed. In the ovaries, papillary serous cystadenocarcinoma or papillary serous cystadenoma. Are these papillary structures? Absolutely. Can I get an amen? Can I get psammoma bodies? Yes, indeed. Papillary endometrial cancer in the endometrium of the uterus. Is this papillary? Sure. Can I get psammoma bodies? Sure. Papillary vulvar cancer can lead to psammoma bodies. Papillary renal cell carcinoma, psammoma bodies. Papillary bladder cancer, psammoma bodies. Papillary breast cancer, psammoma bodies. Papillary skin cancer, also psammoma bodies. Any papillary pathological structure can have psammoma bodies. So on your exam question, when the professor asks which of the following is characterized by the presence of psammoma bodies, just look for the word papillary and choose the answer and it will be the correct answer. But what if you did not find papillary there? Well, then you have to know something else, such as mesothelioma, which is a tumor in the mesothelium. What the flip is a mesothelium? Well, we call it meso because meso means mid, i.e. the layer in the middle, which is the mesoderm. That's why it's called mesothelium. It's kind of an epithelium of the mesoderm. Where do you find mesothelium in the human body? In the famous 3 Ps. What are the 3 Ps? The pleura, the pericardium, and the peritoneum. These 3 cavities can suffer from a tumor known as mesothelioma, which is nasty, really nasty. Say hi to asbestosis. Meningioma can also have psammoma bodies. This is a tumor in the meninges, which cover the brain and the spinal cord. Prolactinoma, a tumor in the pituitary cells that make prolactin. We call them the lactotrophs, or the mammotrophs of the pituitary. To learn more about prolactinoma, see my endocrinology playlist. To learn about thyroid cancers and the different types of thyroid cancer, see my endocrinology playlist. To learn more about endometrial and vulvar cancers, see my obstetrics and gynecology playlist. To learn more about lung cancer, see my pulmonology playlist. To learn more about RCC, see my nephrology playlist. Bladder cancer, see my urology playlist. Breast cancer, see my OBGYN playlist. Skin cancer, see my dermatology playlist. I have more than 2,700 videos on this channel. Medicine is not something that I do. Medicine is who I am. Quick note on alkalosis and its relation to calcium. Please remember that alkalosis favors calcium deposition, meaning alkalosis will make calcium leave its charged ionized form and gets deposited into tissues in the bound form. This lowers the concentration of ionized serum calcium, which can lead to increased nerve excitability and therefore tetany. The relation between alkalosis and calcium is very complex. I've talked about it in detail in my physiology playlist in my video titled Calcium Homeostasis. Next, what is hypercalcemia of malignancy? So I have malignancy, I have cancer. By the way, malignancy means something very specific. It means a tumor. Is it a benign tumor or a malignant tumor? It has to be malignant tumor. And malignant tumors are synonymous with the word cancer. So I have cancer. Whatever the type of the cancer might be, the following might happen. Cancer can increase the formation of PTHrP, parathyroid hormone-related peptide, not to be confused with the good old natural endogenous parathyroid hormone made by your good old parathyroid gland. These two have the same function but a different structure. So what did PTH do? PTH used to do what? To increase serum calcium and trash the serum phosphate. PTHrP is going to do the exact same thing. It's going to increase serum calcium, and that's why many patients who have cancer also have hypercalcemia. We call this hypercalcemia of malignancy. Next, some cancers increase the activity of 1-alpha hydroxylase. What does 1-alpha hydroxylase do? It increases the conversion of the 25-hydroxyvitamin D to 1,25-dihydroxyvitamin D. And of course, vitamin D is going to raise the serum calcium. That's why we have hypercalcemia in cases of malignancy. Next, some cancers will literally invade the bone, causing osteolysis, breakdown of bone. And when I break down bone, what's going to happen? I will have hypercalcemia of malignancy. Some cancers stimulate osteoclasts. Osteoclasts cause osteolysis, which can lead to osteolytic hypercalcemia, and this is hypercalcemia of malignancy. Moreover, some cancers produce cytokines such as interleukin-1, interleukin-6, tumor necrosis factor alpha, and transforming growth factor alpha. These cytokines might stimulate the osteoclasts, and when you stimulate the osteoclast, you get osteolysis. And when you break down bone, you suffer from hypercalcemia. And this is hypercalcemia of malignancy. What causes elevation of PTHrP levels in the blood? Cancers, of course, such as lung cancer, breast cancer, prostate cancer, lymphoma, multiple myeloma, head and neck cancer, and renal cancer. By the way, lymphomas are always malignant. I know that the name might seem benign, but all lymphomas are malignant. And that's why the old name for lymphoma was lymphosarcoma. Definitely malignant. What specific subtype of lung cancer causes the increase in PTHrP? The answer is the squamous cell carcinoma. Not the small, not the large, not the adenocarcinoma of the lung, but the squamous. How do I remember this? I remember that squamous increases calcium. And how did it increase calcium in the blood? By increasing PTHrP. Hypercalcemia of malignancy is a type of paraneoplastic syndrome. And I've talked about paraneoplastic syndromes in detail in a video titled Paraneoplastic Syndromes, and you can find this video in this pathology playlist. Did you know that metastatic calcification can deposit calcium in normal tissues? So you get calcium and you get calcium and you get calcium. This can lead to nephrocalcinosis or pathological calcification of the kidney. And when the kidneys are toast, guess what's going to happen? The kidneys can no longer listen to and obey the anti-diuretic hormone. This is receptor resistance or receptor pathology, making the receptor insensitive to the ADH hormone. And when I am not sensitive to ADH, I will not be able to retain the urine, anti-diuresis, and therefore I will lose lots and lots of water into the urine. Urine volume will go up, and I will keep urinating all the time, and I will keep drinking too much water all the time to replenish the volume loss. This is called nephrogenic diabetes insipidus. So this shows you that metastatic calcification can be evil. We do not study these topics for the lols. Dystrophic calcification versus metastatic calcification. Please take a moment to pause and review. Make sure to watch my video on necrosis and its different subtypes. See my pathology playlist. And to learn about myocardial infarctions, strokes, cardiothoracic surgery, neurosurgery, vascular surgery, trauma surgery, orthopedic surgery, and more. Download my surgery high yields course at medicosisperfectionalis.com. To learn about cardiac arrhythmias, ARDS, acute limb ischemia, detox syndromes, drowning, hypothermia, hyperthermia, and many other emergencies, download my emergency medicine high yields course at medicosisperfectionalis.com. To learn more about ovarian cancer, endometrial cancer, cervical cancer, vaginal cancer, vulvar cancer, and breast cancer, download my obstetrics and gynecology course at medicosisperfectionalis.com. If you value what I do, help me make more videos by supporting the channel. Go to buymeacoffee.com/medicosis. There are more than 750 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.